Hey guys, this is Charity Stanley, and today we're talking about tracheostomies and how important it is that we're able to maintain oxygenation for our patients. So, a tracheotomy is a surgical incision within the trachea to create an airway. A tracheostomy is where we actually are creating an opening or a stoma that results from the tracheotomy. So, this can be temporary or it can be permanent. So the area that you see with the incision on this picture shows that the cut is actually within the tracheal rings, and it is actually a pretty large area. Now, if we have a patient on a trach, we wouldn't be using methods to oxygenate through mask because it's going to just go out of the trach hole. So we would actually need to put oxygen directly over the trach to be able to ensure the patient's able to breathe. So big things we need to watch out for is with a trach, often we will be putting a trach in to get somebody off an endotracheal tube. So endotracheal tubes are great. They're an advanced airway that allows us to have very good control of the airway and be able to help the patient for a significant period of time. But it's important that that only remains in for 2 weeks. After 2 weeks, you have to take out the ET tube and figure out what's next. So if a patient still needs to have very good solid control over an airway after that 2 weeks, we would look at creating a trach. So with this, it's an operation, it's a procedure where we actually cut the trach rings. And big things we have to watch out for post-operatively is the secretions. So that's one thing when a patient has a trach, the secretions are quite intense, so they have to be suctioned out frequently. They will make gurgling noises as the secretions are more difficult to manage. So, several things can happen as a result of having a trach. First thing is our trach can be obstructed from secretions. So we may have to take the trach itself out and change it with a new trach that isn't obstructed by secretions. The trach itself may be knocked out accidentally. Now, if this has been a trach that's been in place for a long period of time, that is not such a dangerous issue. But within the first 72 hours before scar tissue is set up around that trach opening, it having a tube dislodged is a true emergency. So we have to be able to maintain an airway for these patients. When we are doing a trach, we can have complications of a pneumothorax or subcutaneous emphysema. So with subcutaneous emphysema, this is where we have the crepitus and we can palpate air around the skin, around the opening of the airway. Bleeding and infection risk are always something that we have to watch out for, as well with trachs, because it's a direct opening into the body. So our trach tubes usually are plastic today. You, however, will occasionally see people still with a metal trach. These metal trachs are actually reusable. So don't throw, if it's a metal trach, don't throw it away. But most trachs are disposable these days. They come with a cuff tube or an inner cannula. So the inner cannula is the innermost part of the trach, and that's going to be the part that's providing the oxygenation. So a fenestrated tube is going to have holes within the tube as well to help try to prevent those complete obstructions from the actual sputum. So if we have a patient on a ventilator, we're going to need a cuffed trach. And the fenestrated tube is going to allow for coughing and for speaking. So often a patient can actually put their hand over that tube at the end to be able to control the airflow to allow them to cough and be able to speak appropriately. There's several different types of trachs, so it's important to know what your patient has and have extra trachs, especially inner cannulas, available when you have a patient that is on a trach. Also, you need to have suction kits available at the bedside. When the patient is coughing and not able to breathe, is not a time to leave them alone while you are looking for a suction kit. So it's important that you have extra supplies at the bedside. And when you know you have a trach patient, just go ahead and bring two or three into the room for you to be able to use that day. So it's important to be prepared. You also, if you have a patient with a trach, need to have an ambu bag available as well within the room with an adapter to be able to use over the trach. So, carry issues for a patient with a trach. Big thing is we want to ensure that we keep the area around the tracheostomy clean. When it gets secretions on it, clean those secretions off. If the secretions are stuck to the tube tamer, get another tube tamer. Don't leave your patient sitting with secretions sticking all over their airway. The humidification is very important, and it's important to warm the air. The job of the nose and the nasal cavity sinuses is to help humidify air and to help warm the air. Now, we have bypassed those areas by having a tracheostomy. So it's important that you involve respiratory therapy with the patient's care and that you warm the air appropriately and provide humidification. So also with a trach, you have to watch out for overinflation of the tube if it is a cuffed trach, and it's important that you continually assess to make sure that you aren't causing problems for the patient. When you're providing trach care, it's very important that you get a piece of gauze. It's a 4x4 that has one slit in it. This is specifically designed for use with trachs. And so by having good tracheostomy care, we can prevent different problems and complications from happening. So big thing is you want to prevent accidental decannulation, because if you don't have the trach in place, you don't have an airway for that patient. So the tube tamer is the part that you see that goes around the neck and actually holds the plastic trach pieces in place. So when you're getting that extra water, sterile water and suctioning for the trach in the mornings when you have a trach patient, be sure and get extra of these 4x4s. Now, if you don't have these, it is not okay to take a regular 4x4 and place a cut in it. These have been designed and are specially manufactured to prevent lint from being able to get into that person's lungs through the trach. And cut, if you just cut a 4x4, then it is potentially putting lint within your patient's lungs. When a patient has a trach, it's very important that we still provide oral hygiene, because bacteria, Miss Sharon, it's important that we provide oral hygiene and that we encourage them to cough and deep breathe. And we may have to do percussion. This is where we are knocking stuff loose from the lungs to allow the patient to be able to easier cough up the secretions. So when you are doing oral care, it's important that you use a soft bristled toothbrush. You want to avoid things like alcohol from oral care because it is very, very dry. If a person has a trach in place, it's important to realize that swallowing can be hard. When a patient has a trach, you need to keep the head of the bed elevated to semi-Fowlers or possibly even high Fowlers for up to 30 minutes after eating. Talking is something else that's really difficult for a person with a trach, so it's important to use different communication strategies. So you can use a writing tablet, you can use hand signals, you can play charades with the patient to figure out what's going on. Really easy ways that you can be able to communicate with a patient is ask yes or no type questions, and that way they can shake their head yes or shake their head no. And when a patient has a trach in place, it's crucial that at the nurse's station where the call lights are, that you indicate that this patient cannot speak. So when the call light goes off, a person needs to respond to the room to check on that patient rather than communicating through the the call light system. Okay, so with patients with trachs, it's important that you maintain different ways you can communicate with them. So also you need to involve speech and language pathology. These are the people that are the ones that work with patients who have difficulty swallowing. And with a trach, can be very difficult for them to swallow. So they may be on TPN. They also maybe on have a gastric tube and being fed that way. Now, when a person has a trach, it also will affect their self-esteem. It's very frustrating for them because they are not able to communicate their needs. People tend to be rushed when you're entering a room, and when you're working with a trach patient, it's important to allow them time to be able to communicate. It's difficult for them, so it's important that you treat them like you would other patients. So use a normal tone of voice. Many times you will see people who, if communication is a problem, will try to communicate in a louder tone of voice. And with that, it can be very frustrating for the patient because they feel like you're yelling at them and they can't communicate back to you. So it's important that you're able to provide social contact and ensure that they have visitors as well, because this will help to give them something to do with their time and help improve their socialization and ultimately make them feel better faster. Weaning off the tube. So what we do as we're weaning a patient off the tube, we will gradually decrease the tube size. Eventually, we will take out the tube and allow it to heal back. Sometimes they'll have to go in surgery and have it stitched back. Most times we just wean it and eventually the hole will literally just be go away and be replaced by scar tissue. So when a person can manage their own secretions and doesn't get choked or start having difficulty breathing, they don't need the assisted ventilation. So it's important that you recognize this and be able to make the changes accordingly. So you'll change from a cuff tube to an uncuffed tube. The uncuffed tube allows for air to go around the sides of the tube. And we may, when the patient is able to use their upper airway, actually just put a cap on the trach. And so the trach is there if we need it. However, it allows them to start getting used to breathing through their nose and the normal airway. So with a trach, it's important that as the patient improves, they should be taught to provide their own self-care. It's important that when a patient is taking a shower, this is an open access point within the patient's lungs. So it's important that water or shampoo does not run from the shower into the person's body. So you need to have a shower shield over the trach. You need to have it covered loosely just so large bacteria or other things such as a bug does not fly into the person's trach and gain access directly to their body. It's also important to increase the humidity within the home. It can dry out the lungs, and that also makes it more difficult for the patient to breathe. So it's very important that the patient is able to care for themselves and that the family's educated to be able to help facilitate caring for their patient and their loved one who is having respiratory issues.